Hello, my name is Dr. Chris Kolker, and this is ChristianWebMD. The topic at hand is valley fever. If you've lived in the southwestern United States, you probably have heard somebody who has valley fever. That valley is actually considered the Central Valley in California. It's actually a fungus, and it's a fungus that can infect the lungs. Patients with valley fever often will have coughing, maybe even coughing a little blood up. Low-grade fever, they don't feel very good and they feel run down. It feels oftentimes like they have a pneumonia or bronchitis that they just can't get rid of. People who are outside get valley fever much more often. For instance, construction workers are one of the leading types of people that get valley fever. As a fungus, it's the spores that are in the ground that get blown with dust into the lungs of the patients who ultimately get valley fever. Valley fever oftentimes is found on an X-ray as a simple ball of inflammation that the patient may or may not be aware of. And in fact, many cases of valley fever are found on routine X-rays. Valley fever, in rare cases, especially those with weakened immune systems, can be life-threatening. So valley fever does need to be treated in anyone who feels that they have an illness. Valley fever can be treated very effectively with something called diflucan, an antifungal agent. Diflucan may have to be continued for many weeks, and consultation with your physician is in order to decide how long that treatment needs to be. Rarely, valley fever can even invade things like the central nervous system or even other organs. Unfortunately, that can be fatal, but fortunately, that is pretty rare. Remember that this video is for educational use only and is not designed to diagnose or treat any disorder, such as valley fever. If you have questions about valley fever, please contact your physician. And thank you for watching ChristianWebMD.